Point in Concord tonight, where House Republicans are taking steps to dismantle one of Governor Maggie Hassan's signature legislative achievements. Good evening, New Hampshire. I'm Tom Griffith.
And I'm Shelley Walcott. Tonight, Medicaid expansion is on the chopping block, potentially cutting access to health care for 39,000 Granite Staters. Our Adam Sexton joins us live now to explain the looming budget showdown. Adam.
Well, Tom and Shelley, House Republicans tell us they're looking to cut approximately $240 million from the governor's proposed budget. They tell us $180 million of that will be coming out of the Department of Health and Human Services, so there are a number of big cuts to be made in addition to the proposed cut for Medicaid expansion. House Republicans are making good on their promise to eliminate Medicaid expansion, known locally as the New Hampshire Health Protection Program, voting in committee to allow it to lapse at the end of 2016.
It will not be in the House budget. The people of New Hampshire do not like the Affordable Care Act, known as Obamacare, and we were elected to represent that position, and that's why it's not going to be in there.
And that means about 39,000 people will lose health insurance, and that is going to be devastating to those families.
Democrats are decrying a number of proposed reductions to the HHS budget, including Meals on Wheels, the Sununu Youth Services Center, and homeless shelters. While they helped elect the current speaker, Democrats believe the cuts are being tailored to win the support of conservatives, still smarting from that defeat.
I think part of the issue is how do the Republicans get their budget passed?
Republicans say this is purely about the money.
The governor had unrealistic and excessive revenue estimates.
But Governor Maggie Hassan disputes that, saying revenues are on track and that Medicaid expansion should stay in the budget.
We've seen the rate of uninsured at our hospitals and our healthcare providers go down. We see increased access to preventive and primary care, a healthier workforce, creation of jobs, and strengthening of our economy.
It's important to point out it's still very early in the budget process. The Senate still has to weigh in, but obviously the House is drawing a sharp line in the sand. In the newsroom, Adam Sexton, WMUR News 9.